little anxious ever since the beginning of COVID.
I'm getting better now.
Not the best, but not the worst.
I'm fine.
Hiện tại thì cái sức khỏe của tôi đang rất là ổn.
I'm doing good, actually, better than before.
I'm good. I'm fine actually.
I have been feeling a little bit more stressed lately.
It's been quite overwhelming for me, and I know it's also overwhelming for many other young people across the globe because of COVID.
In the beginning of COVID, my mental health was impaired because the rising number of pandemic around the world.
It impacted me in a way that I never thought it would did before.
And even for me, it was quite depressing because I can't even do my job.
Thật sự cái đại dịch Covid-19 nó ảnh hưởng không nhỏ đến cái sức khỏe tâm trí của tôi. Tôi luôn phải sống trong một cái sự lo sợ và cái sự phát triển không ngừng và cái mức độ lây lan kinh khủng của Covid-19.
Because of living as disabled and gay, it was a challenge, and to live alone in isolate, it made me physically, mentally, and emotionally very hurt.
I really got stressed and I felt so much anxiety during those times.
I was actually fine. I actually enjoyed working from home, but the second year I really started struggling. I missed my family overseas and my friends overseas that I considered family. So yeah, it's had a bit of an impact on me this year.
I overcome my anxiety and stress in a sense that I do exercise.
For me, my peer support system, my friends, has been my biggest support to overcome the anxiety and many other issues related to my well-being.
And I was lucky to have friends supporting me from virtual spaces.
A lot of support, especially from my friends, from my family, and as well from my working colleagues, to look at the brighter things from what has actually happened.
First few months I struggled a lot, and then I started researching online to find the communication that I can be a part of through online, so it helped me a lot.
And sadly, I was jobless before September 2021, so I cannot afford for any healthcare, especially for mental health services. Well, I stay communicated with my friends virtually, mostly with my trans sisters, even though it doesn't help fully, but it still helps.
Quite drastic mental health issues, like they went down to anxiety, depression due to loss of jobs, and even couldn't find jobs after even graduate.
So being the Youth Lead Secretariat, we have seen the situations our country partners are in, not being able to access medication, a reduction in financial assistance, and not being able to step out of the home, which is an extremely isolating situation. And we have to remember that sometimes for some people, home is not always the best environment to be in.
Do young key populations access equal mental health services? I think no.
But there are actually several number of NGOs, CBOs, private sector, and even the government sector has actually provided mental health services and also psychosocial support services specifically catering to the Yankee population.
YKPs have mostly the same mental health problems.
But sadly, YKP and youth peers do not have the same or equal access to mental health, especially those who are minorities such as people living with HIV and LGBTQ plus community. Even before pandemic, they don't have that exact accessibility to those services because one, it is not inclusive for them. Two, it is very costly to undergo mental health treatment, and it is very costly even the consultation itself. And third, they feel like they are not welcome, and that is a problem.
I think not only in my country but globally that mental health services should be free or at least subsidized for young key populations and young people who are most often disproportionately affected by global pandemics such as HIV, COVID-19 that ultimately end up affecting their mental health.
Mental health matters, yet the insufficient understanding of comprehensive sexuality education and the power dynamic between young key population, young people, and adult service provider are the barriers for us to access and receive equal mental health services.
We need to have more stronger peer support systems in absence of rather service delivery systems in health settings and institutions.
I wish everyone think that therapy is just like a coffee shop service.
Therapy should be accessible and
inclusive,
Free, no stigma and discrimination, and accountable.
So for me, equal access to mental health is important. Health for all is very important. So please take care.